Okay, hello, my name is Jeff Peterson from Petersen Physical Therapy, and we're going to talk today about hip and a hip injury, and we're going to show some exercise to kind of deal with a hip injury. So if any of this is helpful, please like, subscribe, and share. Just smash the button that you see. We got Steve here today. He's a good friend of mine. I've known him for years. Called me up yesterday. He said he hurt his hip golfing. I've golfed with Steve a few times. I have an idea his swing, and what I suspect, and we're going to try to confirm that, is when he swings, he plants his right foot. Any of you golfers know, Nick Faldo says right knee to left knee when you swing. So you want to rotate that right hip, get the knee to hit. That may or may not have happened. He reports some pain in his groin. So scale of 0 to 10, what would you say?
10.
10.
Happen, yeah.
At its worst and at its best?
0.
0. So right now, lying here, you have no pain?
No pain.
Okay. So what I'm going to do is take him through a quick evaluation to see what provokes his pain. Because the first thing in dealing with pain is you want to know yourself and know what is it that provokes the pain, what helps it feel better. Okay, so we're going to take Steve through just a series of tests to see if we can provoke his symptoms a little bit to identify the tissue that might be involved. We're talking about his right hip. In the hip, you've got the hip joint itself, you've got the capsule that surrounds it, those are the supportive ligaments, and then you've got the muscles that move. And he's reporting pain inside medial, we call that medial, right in the groin area. So Steve, let me have you slide your heel up towards your bottom, okay? Does that hurt when you do that?
No.
Okay, so I want you to drop your knee out this way. Does that hurt when you do that?
A little bit.
A little bit.
Yeah.
Now I want you to pull into my hand.
Yeah, a lot.
So that's the one. So active movement of his adductors causes pain. So now I'm going to look at just a straight stretch. Does that hurt there?
A little bit.
A little bit, and then pull in with your foot, and then a lot.
Wow.
That's the one. Okay. So on camera, I'm not going to palpate, but I could palpate on the pubic bone where the adductor attaches. I will palpate the muscle belly. The other thing that's interesting is he's got no bruising and no swelling in the muscle. So as a physical therapist, when we're trying to determine, is it muscle, is it tendon, is it the joint? If it was his joint, it would likely hurt more when it moves or if I move it passively. So let me have this here. That doesn't hurt?
No.
And if I push in here, does that hurt? Does that hurt there?
No.
Does that hurt there?
No.
Okay. So likely the joint is good, and I'm guessing, obviously, from experience and clinical tests. What I would suggest is instead of being the muscle belly, it's the tendon that attaches to the bone. Now, tendon is different tissue than muscle. It's got some of the same fibers, but it's more dense, and the circulation is not quite as good. So that's the thing you got to keep in mind. If it's a muscle heals quickly because there's so much circulation to it. Tendons, not so much. So we're going to guess that Steve has a irritation or maybe even a slight tear of that tendon. It's hard to tell the extent of the damage. So what it will take is, if it's not better in 2 weeks, then we would do more testing. I would think that if we get you on a good treatment plan, you'll be better in 2 weeks.
Okay.
Does that make sense?
Yeah.
Okay, so now we're going to take him through some exercises. Okay, so looking at Steve's hip. Steve's a golfer in his mid-60s. After swinging a golf club, noticed some sharp pain in his hip. And we've kind of determined, or we're going to operate on the assumption that it's his adductor muscle and the tendon where it attaches on the pubic bone. So I'm going to give him some exercises. So everybody knows the rules: rest, ice, elevation. It's difficult to elevate a tendon that's in your groin. And there's really no swelling. So heat and ice at this point, 2 or 3 days later, I think we're on day 4, they work about the same. So we want to increase the circulation to the area, then decrease the inflammation. But the other thing that often gets missed is we want to apply some modified tension to that tendon so that we can increase the active circulation and help it heal. So the first exercise I'm going to do, I'm going to take your shoe off here, Steve. Now you tell my wife I was undressing a man, I will deny it. What I want you to do is you're going to slide your heel up towards your bottom and then slide it down. And you're going to do this for about 3 minutes. So we're not going to do it 3 minutes here, but he's going to do this at 3 minutes at home twice a day. So that's actively working his hip flexors and gently working the adductors. So that's how you're going to increase the circulation and put a little bit of gentle tension on that tissue to help it heal. Okay? So you go with that? So you do that for about 3 minutes. And then what I want you to do is slide your heel up. And now I want you to drop your knee out, just to there and in. Now keep in mind that now the adductor muscle is moving the weight of his knee. Now normally that's not a lot of resistance, but in a freshly injured tendon, this may cause some discomfort. So does that hurt at all?
Just slightly.
Okay, so just come to the point.
Okay.
So again, this for 3 minutes.
Okay.
That'll be, what's about 100 repetitions if you go nice and slow.
Okay.
Okay? So, off the table before he sits up, he's going to ice, he's going to heat first, he's going to exercise. He goes to the gym where they have one of those adductor machines. He's going to use that for some gentle stretching. And then he's going to ice when he's done. And he's going to do that twice a day for the next 2 weeks. Okay, so let's have you sit up, face the camera. So the next exercise is, so there are no real internal rotators of the hip. The adductors contribute to that, and there's a couple other longer muscles. But what he's going to do, he's going to slide this heel up his shin and then down, just like that. Does that hurt when you do that?
No.
Okay. You're going to do that for 3 minutes.
Okay.
So again, he's stressing the injured tissue, but he's stressing it within the confines of being pain-free, and he's doing it for a lot of repetitions to increase the circulation and to help that tissue heal. So he's going to do 3 exercises for 3 minutes, which is about 9 to 10 minutes of exercise by the time he transitions. That's after he heats it for 10 minutes, and then he's going to ice it for 10 minutes. So it's about a 30-minute regime that he's going to go through at home twice a day for the next 2 weeks, and then I'm going to check with him in 2 weeks and see how his hip is. So if this has been helpful, please like, subscribe, and what is the other one? Not submit. What's the word I'm looking for? And share. We want to share. We're sharers, all right, Steve? Yeah, we are sharers. And then if you have any questions or concerns, you can get a hold of us on our website. So thanks for listening.